Hey, Dr. Jerry Williams here with Urgent Care 24/7. Going to talk to you about a topic that we get a lot of patient visits with, and we get a lot of calls into our call center with. And the topic is burns. Now, unfortunately, burns are a pretty common injury, and as you know, if you've ever had one, incredibly painful, and can also be really a very serious problem. So I want to give you some information because if you're looking at this, you've probably done a search online and you want to get some information about how to handle a burn for yourself or a loved one or a friend. So first thing we want to do if you've got a burn is get the area immersed in cold, icy water, and we want to cool the area down, which will give immediate pain relief and will stop any ongoing damage to tissue from the heat. So immediately get the area immersed in cold water, and then very quickly you need to do an assessment. And the things that can happen with burns is, there's first, second, third degree burns. First degree burn, there'll be redness to area and pain. Second degree burn, you'll see blistering. And third degree burns are actually not as painful because they're actually burned all the way through the tissues, and the nerves can and are affected. And so some of the worst burns are actually not painful because the nerves themselves have been damaged and they're not working any longer. So you need to assess if it's a first, second, or third degree burn. But even, for example, a second degree burn can be very serious if it's circumferential, meaning does it go all the way around your hand? Does it go all the way around your finger? Does it go all the way around an extremity? But also by the location. If you've got a burn to the face, around the eyes, those can be very, very serious burns. Burns around the face, around the eyes, around the nose and mouth, for example, can also be a clue that there could be smoke or heat damage from inhalation of heat into the airway. So any burns that are circumferential, that are involving the eyes or around the face, or if it's a large burn that's affecting a significant area of the body, you need to get in to see a physician or a healthcare provider immediately. So that would mean urgent care center, or if the burn's extensive, emergency room immediately. Dialing 911 in the case of a serious burn, never a bad idea, ever. So what are you going to do when, what's going to happen for you if you have to seek care for burns? Well, in a hospital setting, they're immediately going to give pain medication and start cleaning the wound and assess the degree of damage. And then immediately treat the wound with antibiotics. Topical antibiotics are frequently used. There's actually a sulfasalvadine cream that is used that's very soothing, and it's an antibiotic that can be used on many people's burns. And then the ongoing wound care of a burn is critical because wounds take a long time to heal. Burns, I should say, take a long time to heal. So they have to be taken care of very appropriately. They have to be debrided, meaning you have to get rid of the dead skin and the dead tissue as the wound is healing. And that will speed up healing and decrease scarring. Scarring is obviously very, very common with burns. Home type treatment, if you've got a minor burn, again, as I mentioned, is ice. And you don't want to freeze the area, but you don't want to damage the tissue by freezing the tissue. But getting cool ice water on the burn and soaking it intermittently is certainly acceptable. And then taking either acetaminophen, or if you can, take a non-steroidal anti-inflammatory drug such as ibuprofen or naproxen sodium. Or in the case if the pain's significant, you can take acetaminophen and an anti-inflammatory drug such as ibuprofen or naproxen sodium together for pain. Also, topical sprays that have lidocaine. There are gels and sprays that are made that have lidocaine, a topical anesthetic in them that can help with the pain. And also there are gels for burns that we've talked about with our sunburn talk that are used for sunburn that also will have aloe and soothing kind of topical gels. Also, there are There are sprays that are used for burns that have an antiseptic and a topical anesthetic in them as well. So if you've got a burn here at home and you're at home, immediately immerse the area in cold water and assess the level of damage. Again, looking for circumferential, large burn, anything around the face, eyes, nose or mouth, or anything circumferential around an extremity or finger or digit. And seek medical care immediately. Don't be surprised if you do seek medical care to be sent home on antibiotics preventatively for infection and on appropriate pain medication. And if your tetanus shot isn't up to date, they'll update that as well. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe. And when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7 and so are we.